WRKS Pickens Jackson.
Are you ready?
Now live from the Whiskey 61 Lounge inside the BankPlus Studio.
You are
listening to
Mississippi's #1 sports talk show, The Out of Bounds Show with Bo Bounds. Streaming worldwide live on the Out of Bounds radio app and on your radio at ESPN 105.9. The Zone.
And good morning. Welcome into the Out of Bounds show on ESPN 105.9 The Zone, brought to you by Mississippi Sports Medicine and Orthopedic Center. We have a special guest in studio. I think this is his fourth time on the show, but he has been in studio before. And Dr. Larry Field joins us with Mississippi Sports Medicine and Orthopedic Center. Dr. Field, good morning. How are you?
Thank you, Bo. I'm doing great and happy to be here. Thank you.
How's everything going at Mississippi Sports Medicine?
It's going great. You know, we've been fortunate to have an opportunity to treat and help a lot of patients, and that's why we're there.
Let's start with a little sports, and then we'll get into some other things. Would you describe what type of injury Russell Wilson with the Denver Broncos is going through?
Yeah, sure. Yeah, he had a kind of an unusual injury. It's an injury to a muscle in his shoulder called the latissimus dorsi, and it's uncommonly injured, unlike rotator cuff muscles and that type of thing. But it can be quite debilitating, and that's a big muscle from the back. That big muscle in the back that we see that runs down the spine is actually the latissimus dorsi, and it hooks into the shoulder and is very important, powerful muscle as far as force transfer. He injured it, and it can, greatly diminish your ability to throw effectively. I think Dak Prescott had the same injury about a year and a half ago in training camp. So that's what it is, and that's why he's having problems right now.
So when you hear, this could be totally different, but when you hear dead arm, that's totally different.
Yeah, that's more of an instability. If the shoulder's slipping out or shifting, you can get that sensation. This is more of a muscle-related injury that causes pain and some weakness limitations and ability to throw. And
what is the recovery time usually?
Yeah, it's these injuries can be quite problematic. They're very uncommon. There's a study out there that shows that for patients who have a partial tear, which is very likely what he has, that the return to play is as much as 3 months. Now, I don't think he's going to be that guy. Just to be clear, he's still trying to participate. He probably had a strain and not a partial tear. And I saw that he just got an injection of what's called PRP this week. So hopefully he'll be back on the field ASAP.
And what is PRP?
Oh, PRP is just, patients will come and ask sometimes for PRP injection. Your listeners may have heard about it. All it is just a certain part of the blood that we can spin down and re-inject into the body part that's injured, and it can theoretically enhance, improve healing, that type of thing.
Dr. Larry Field on the Out of Bounds show with Mississippi Sports Medicine and Orthopedic Center. Let's go to Tommy John surgery.
Yeah.
We, sports fans talk about this injury all the time because we're following our pitchers, among other athletes, and we're a huge baseball state, or they're following their MLB team. Now, years ago, nobody came back, or most people didn't come back from it, and now we see guys come back from it, and they're very productive, Dr. Field. But you talked about last week how there may be even more of an advancement in the surgery and rehab going forward.
Yeah, I appreciate that. Yeah, in the last few years, there's been quite an innovative implant that's become available to us, those of us that do Tommy John surgery, and that has a specific name. It's called an internal brace, and we utilize it commonly now. And what the basic problem is that when the Tommy John ligament on the inside of the elbow tears, it's almost impossible to pitch at a high level. So you have to have that ligament repaired or reconstructed. And for those athletes that have more of an acute tear but an otherwise pretty good ligament, we can use this implant. It's like a collagen-coated buttress, if you will. So you can repair the ligament, you put in this implant, and it can significantly speed up recovery. But for example, if you reconstruct a Tommy John ligament with the graft, which is traditionally what's done, it takes 9 months to a year probably to get that athlete back to performing at a high level. This internal brace, when it's indicated, and the studies show this, can get athletes back to about 6 months. So it's quite important, because if you think about a college pitcher, for example, and he has an in-season injury, he could theoretically miss his next year of eligibility. But if he's the right patient for this type of intervention, he could be back, 6 months later.
That's incredible. Did you hear that, Blake Scott? In this state with back-to-back national champions?
Well, I mean, you're talking about millions of dollars of value. Yeah, absolutely.
Okay.
Yeah.
Real quick before I get into the fellowship program, you would still recommend young people resting their arm 60 or 90 days, especially this time of year, if you play a ton of baseball? Right?
Oh, yeah, absolutely. I think one of the reasons there's been such an increase in injuries is because it's essentially a very specialized activity now. It goes on year-round. It's the problem.
Dr. Larry Field, Mississippi Sports Medicine and Orthopedic Center on the Out of Bounds Show. Let's talk a little bit about the fellowship program that y'all created at Mississippi Sports Medicine and Orthopedic Center, and the impact that it's had and how long it's been going and kind of what it does year to year.
Yeah, happy to do that. Yeah, we've been really fortunate to have been able to train orthopedic surgeons at our institution for many, many years. In fact, this is the 30th anniversary of our sports medicine fellowship. And what that is this, because it's confusing what a fellow is. When somebody finishes college and they become a doctor, they go to 4 years of med school. Then if they do orthopedics, they go to 5 years of orthopedic surgery residency, and a fellowship's an additional year after they finish their orthopedic surgery. So we have 5 surgeons essentially that come spend the extra year with us learning just sports medicine techniques, the rotator cuff, Tommy John reconstruction, knee surgery, etc. So that when they go out, they're subspecialized in this sports medicine related treatment.
Like your subspecialty is shoulder and elbow.
Correct.
And everybody in the Mississippi Sports Medicine world and Orthopedic Center has their subspecialty.
That's correct. Yeah, we're all subspecialists. We only do essentially one thing.
Yeah. Mm-hmm. Out of Bounds, ESPN 105.9 The Zone. We're visiting with Dr. Larry Field on the Out of Bounds show. All right, let's switch gears here. What was your? I'm gonna throw a curveball at you. No pun intended on the baseball.
My first girlfriend? Or?
No. This is. I'm not going to go there. All right. What was your toughest class in biomedical engineering?
It was a class called Dynamics, and I think it was in part because it was during football season and we were having too much fun.
Right. Fair enough. See, when I was at Mississippi State, I just went through the engineering buildings just to hit the restroom real quick. That was all they let me do, the chemical, biochemical, and so on.
Well, you've done pretty well for yourself.
Dr. Larry Field on the Out of Bounds show. All right, here's another one. Blake and I were talking about this earlier. And since you did a fellowship with the New York Mets after your 5 years at UMC, should Dale Murphy, former Atlanta Braves NL MVP, should Dale Murphy be in the Hall of Fame?
Quite controversial. He was a hero of mine when I was a kid. So without any evidence to support it, I say yes.
Me too. Me too. And I saw, they named all the Hall of Famers within the last few days. And Blake, I don't know if you saw it, but Crime Dog McGriff got in, who played for the Braves and Montreal Expos, but Dale Murphy did not make it. Well, excited for y'all. Y'all are growing. And everything started on fortification, and now you've got the beautiful new surgery center and clinic, Lakeland Drive, Flowood. I know you're excited about Mississippi Sports Medicine and Orthopedic Center, both now and the future.
Well, thank you. Thank you. We've been very fortunate, and thanks a lot, Bo.
Dr. Larry Field on the Out of Bounds show, ESPN 105.9 The Zone. We're streaming live on thezone1059.com and the Out of Bounds radio app. And if you missed any of that interview, you can go to Apple Podcasts or Spotify and search Out of Bounds with Bo Bounds. At 8:30 today, we'll have Mike Detillier, WWL Radio TV New Orleans. Mike will join us on the Yingling Lager guest line. The Saints, gut-wrenching loss last night as Mark Ingram ran out of bounds about a half yard before the stick. And that would have put the game away. And that takes them out of the division run with the Tampa Bay Buccaneers. Dr. Larry Field in studio, Mississippi Sports Medicine and Orthopedic Center.